Welcome to Tips for Taming Stress During the Holidays. I would like to welcome our presenter this evening. Charla Wells DiGregorio, PhD, is the past chair of the Ohio Psychological Association Professional Practice Committee. She is an assistant professor of psychiatry, psychology, and internal medicine at Ohio State University. She serves full-time as a clinical health psychologist for psychosocial oncology and is director of the Psychosocial Oncology Fellowship Program. She completed her PhD in clinical psychology at Northwestern University, an internship in medical psychology at UCLA Neuropsychiatric Institute, and a research fellowship in biobehavioral oncology at The Ohio State University. Dr. Wells DiGregorio's clinical interests include providing psychological interventions for patients and families with advanced disease and facilitating communication and treatment decision-making. Her research examines neuroimmune mechanisms of symptom clusters among patients with advanced disease, as well as psychological and symptom management interventions for patients and families with cancer. Please welcome Dr. Wells DiGregorio.
We're going to be talking about some tips to tame holiday stress, but a lot of what we'll be talking about will also apply to just general situations for which you might be experiencing some stress. And so to get started, I'd like you to think for a minute about some of the things that tend to make your holidays more stressful than your average days or weeks. So just take a few minutes and think about some of the things that come to mind during the holidays that make them stressful. So typically during the holidays, we tend to experience the normal things that make people feel stressed. As a psychologist, the list that you see of typical stressors are some of the things that people bring to sessions as most stressful for them. So different health-related issues for self or family members, work-related stressors, household responsibilities, just feeling like there's too much to do between work and home and childcare, finances, transportation difficulties, friends and family conflicts, and then definitely deaths, divorce, moving, and caregiving responsibilities, particularly for women as they're often caring for older adults, but also children in the home, so they often have a dual caregiving role. But also sometimes men play both roles as well. So on top of all these typical stressors, with the holidays we encounter a whole set of different stressors here in the Midwest. Weather changes, additional parties or required social obligations, additional household preparations and cooking if you're sponsoring holiday events. Gift receiving and giving, which I never really thought of as a stressor, but knowing from my own husband, he finds it very stressful to find the perfect gift for people. So that can be another aspect of stress for people. Travel, especially visiting relatives, long distance. Overindulgence, so that usually rears its head after the holidays, and then both in terms of finances and just changes in eating patterns during the holidays, and then just the increased emotional intensity of the holidays. So if you're experiencing grief or sadness, that may become more pronounced during the holidays because the people around you might be expressing a lot of joy or other emotions, and you may not be feeling in sync in that case. Or just the level of joy. A lot of times if people are depressed during the holidays, they may experience difficulties just meeting others' expectations for how they should be feeling during this time of year. And then loneliness is also a big one. So if people, especially for older adults, if they've had multiple family members pass away, and so they don't have maybe strong family connections or the usual places that they might go for the holidays. And then our expectations too tend to change during the holidays. So we expect more from ourselves and often expect more from other people during the holidays. So when you are living with cancer or a family member living with cancer, on top of the typical stressors and the holiday stressors, you might have a whole layer of cancer-related stressors. So you might need to attend multiple medical appointments, which further limits your time. There might be nausea or appetite changes, so that you may not be looking forward to or even enjoy the additional meals, or maybe too nauseous even to contribute to preparing meals. There might be fatigue or pain that interferes with your activities. Some sleep difficulties that can come along with that. So you may find that you're feeling more irritable just because you're not sleeping well and you're fatigued. And then there could be changes in physical function, body image changes. So talking to a few people this week, they're concerned about going to different friend or family events or work-related events just because their appearance has changed so much. They may have lost weight, or so they're just not comfortable being around other people given the body image changes. Medical expenses too, like that can change your holiday preparation or budgeting. And then work and school changes. So people who are going through active treatment may have not been able to go to work, so they're not sure how to manage the holiday parties. And then especially if they're going through chemotherapy, might be thinking, should I go and expose myself potentially to colds and flus and other things. And then also, like, there's changes in time perspective for many people with cancer. Just getting the diagnosis of cancer often causes people to think more in the short term in terms of their planning. So thoughts might come up such as, is this going to be the last time that I'm able to enjoy this? Or this we better make this extra special. So there's this whole other layer of expectations that might come along with cancer during the holidays. So tonight we're going to focus on these objectives. So we'll talk about how it is that we define stress, and then we'll talk a little bit about the impact of stress on us physically. And then we'll talk about 4 strategies. We're going to talk about a lot of different strategies to reduce holiday stress, but I crossed out holiday because I think this applies in general to strategies for reducing stress. And then we'll talk about some of the similarities and differences between grief, depression, and seasonal affective disorder. So what is stress? Raise your hand if you've ever experienced stress, and raise your hand if you're very familiar with stress. Yeah, so it almost, you know how it feels, but this is how we would define it. So stress, the things that we were just talking about would be considered stressors or things that could produce stress, but stress is really our reaction or our perception. And that's a good thing, because being a reaction or a perception means that it's something that's changeable with practice. But stress arises when we perceive that we can't control or adequately cope with the demands being made on us or with threats to our well-being. So it comes about when you feel like there's just too much and it feels overwhelming. And along with that, you feel like you just can't cope with everything that's coming up. This is the transactional model of stress. So I like this because it gives you room to think about when something happens to you. There's actually a lot going on in our minds in terms of how to deal with stress and what the eventual outcome is. So something stressful happens, like your car breaks down and you're getting ready to go to a medical appointment, for instance. The first thing your brain is going to ask is, what does this mean? Is this a harm or a loss? Does it threaten me? Or is this a challenge to overcome? So in general, if you're looking at something as a challenge to overcome, it's going to feel less stressful than if you're viewing it as a potential harm or loss or a potential threat where something's going to be taken away from you. Then the mind, after it kind of sorts through, what does this event mean to me? You have the secondary appraisal, and that's where you're kind of sorting through, do I know how to cope with this? Have I encountered anything similar to this? How might a friend cope with this? If the answers to some of those questions are, I got this, I've done this before, I know exactly where to take my car, or I know exactly who to call about this medical appointment, we'll get this straightened out. If you feel like it's something you can cope with, or you have a self-efficacy expectation, your level of stress is going to decrease. So anything you can do to think of additional coping strategies or people you can contact and say, how would you deal with this problem, and try to solve the problem, the less stress that you might experience. And so then after all that's said and done, that's when you actually start to engage in stress and coping process. What about this? Is all stress bad? What do you say? Yeah. What makes you say no? What do you think?
Because sometimes stress can be a motivation.
Uh-huh.
It can make you move a little quicker.
Mm-hmm.
If you're feeling overwhelmed, or if I'm feeling overwhelmed, sometimes stress can motivate you.
Mm-hmm. Yeah, stress can motivate you. It can get you out of bed, and she was saying it can move you quicker. I'm going to repeat a lot of things, not because I like repetition, but just because some people may be watching online and they may not be able to hear. So I'll try to repeat your responses. So, and I'm going to try to make this somewhat interactive. So yeah, and Yerkes-Dodson, in the early 1900s, pointed that out. For every situation, there's an optimal level of stress. So you're exactly right. Typically, too much stress or too low of stress or arousal is not a good thing. Like you say, if you have a test or a task and you have really low arousal or motivation, you may not be prepared. Or you may not prepare or study or do the things you need to do for that. And if you have too high a level of stress, you may not be able to concentrate or focus or perform well on that task. But every task that you have has an optimal level of arousal or stress that will make performance easier. So our goal is tonight not to get rid of stress, but for you to start thinking about what's the optimal level of stress for me to have about this situation. So we'll talk a little bit now about how stress gets under the skin, because you've probably all heard about some of the health impacts of stress. So there's a couple primary ways that stress gets under the skin, and the first is the fight or flight responses, and the other is the hypothalamic pituitary adrenal axis activation. So we'll walk through both of those. So your nervous system is, your autonomic nervous system is divided into parasympathetic and sympathetic. Your sympathetic nervous system is what gets revved up when you're ready to fight or flee a dangerous or stressful situation. So that worked pretty well for us in the time of lions, tigers, and bears, and when that's a threat. But now every time you're encountering daily stress or hassles, your sympathetic nervous system is still getting revved up. And so some of the things that happen when you encounter threats, your pupils get dilated so that you're able to see the threat more accurately. Your bronchi relax, your heartbeat accelerates, so you're just pumping more oxygen throughout your body into your large muscle groups. So as if you needed to escape a lion, tiger, or bear, your body's kind of revving up for that fight or flee reaction. Your stomach stops digesting, so everything just sits there. And if you're in the animal kingdom, everything just drops out so that you can fight or flee and focus on the attack. So your digestive system is definitely effective. Blood sugars get released, so they're also going to your large muscle groups to help with energy production. So whenever you're stressed, you see an increase in blood glucose. And then your bladder relaxes, so bladder control can change. So that's what happens when you're under stress or threat. There's also a hardwired system called the parasympathetic nervous system, and that's also known as the rest and digest system. I picture that as whereas if fight or flight, you're running from a lion, tiger, or bear, the parasympathetic system, you're laying in a hammock on the beach. So that's where your system kind of cools down. And you need both to have kind of a healthy balance, like stress response system. So your pupils contrast with the parasympathetic system, your digestion resumes, your heart rate returns to normal. And your body in general just enters into relaxed mode. So that's one way in which our bodies respond to stress. So it's called the SAMI response. The next is the hypothalamic pituitary adrenal axis. And so the process here starts in our brain. So the hypothalamus is responsible for kind of sorting out what's stressful, what we need to respond to. It triggers corticotropin releasing hormone, which triggers the pituitary, that then causes the adrenal glands to release cortisol. Have you heard of cortisol before? Yeah, cortisol is a stress hormone. So in the first system that we were talking about, the SAMI system, that's where you release norepinephrine and epinephrine. And in this system, cortisol gets released, and then it triggers more norepinephrine and epinephrine if you need it. So both of these systems combined can rev up your immune system and cause this cascade of pro-inflammatory responses. So that's where you start to see a lot of inflammation in the body, which can affect wound healing. It can affect you getting more common colds. So that just means your immune system is really revved up and in an inflammatory state. And we also have anti-inflammatory processes that are kind of a feedback, and that eventually shuts down. But some people can be in a perpetual state of stress, where their body is kind of always revved up and ready to fight or flee. That creates a lot of wear and tear on the system, and what you see in that case is over time, usually middle adulthood or later, you start to see their bodies having less of a stress response, so there's not as much like cortisol. When it does elevate, it takes much longer to come down, so they're in this more persistent state of inflammation. And you start to see wear and tear on the body as a result. These are some of the diseases and illnesses exacerbated by stress. So definitely more frequent migraine and tension, headaches, temporomandibular joint dysfunction, where people just clench their jaws, like sometimes throughout the day, but then also at night, so that they wake up with really painful jaw. Heart disease, asthma. Some people tend to focus their stress more on the digestive system, so ulcers, colitis, irritable bowel syndrome, and rheumatoid arthritis, because arthritis is a inflammatory process or disease. Cancer, we're still kind of out and thinking about stress causes cancer. We know that stress contributes to a lot of conditions that can affect cancer. I think there's an equal number of studies that support stress causing cancer and an equal number of studies that support like stress does not contribute to cancer. But it definitely contributes to inflammation and healing and some of these other processes. Other effects of stress that are equally important is stress is associated with the development of depression, post-traumatic stress, and pathologic aging. That just means early aging. So you're aging before your time. You might be 50 but feel 80. Affects fetal development and outcomes. So there's lots of interesting research that's coming out about stressed mothers and the impact on their infants. It predicts negative health behaviors and relapse, and this is one of the factors where there's kind of a link between stress and cancer. So when people are more stressed, they might tend towards increased smoking, alcohol abuse, illicit substance abuse, and definitely poor sleep habits, and those things in turn may affect cancer survival. It also reduces the ability to concentrate or focus, which contributes to memory problems. So a lot of people will come in to see me for cognitive screening and say that they're having some memory problems related to chemo brain. And chemo brain in general is real difficulties with things, your reaction times being slower and not being able to multitask can create some difficulties with short-term memory, but that's usually a result of concentration issues, because if you're not kind of processing information, if it's not going in, you're not going to be able to remember things as well. That also happens with stress and anxiety. If you just have so much going on out here that the information is not going in, that most of the time can produce what looks like chemo brain. I'd say probably maybe 6 times out of 10, rather than chemo brain, it's an issue of anxiety and stress contributing to memory issues for the person. So now we're going to turn to, now that we know a little bit more about stress, some strategies for reducing holiday stress. So we know some strategies that don't work. So when people say try to be more positive, that does not work. That just increases irritability most of the time. So if you were able to be more positive, most of the times you would be more positive. So that just creates like an additional level of stress that most people don't need. Just stop worrying too. That's kind of a corollary of that. Don't worry, be happy. Most people, if they could stop worrying, they would do that. Yeah, she said like a switch. They want you to have a switch, but we just don't have a switch. And when we do try to use that switch, there's a study by Wegner in 1994, and that was I think it was the white bear study. And he had a group of people that he told not to think about white bears, and then another group that he told to think about white bears, and then followed up with them like several hours later, and he found that the people he told not to think about white bears during this task just could not think about anything but white bears. So it kind of introduced studies on what we talk about as thought suppression. So anytime you try to squash something down or not think about it, it oftentimes just unleashes more thoughts about it. So one of the keys in reducing anxiety and stress is to actually expose yourself, and that's part of post-traumatic stress disorder treatment now. Instead of avoiding or not talking about things, it's kind of bringing it all to the front and dealing with it more directly. And that's the same reason that, say, alcohol or drug overuse don't work, because they're usually avoidance or numbing techniques. And then distraction and procrastination. they tend to get reinforced because you feel better doing them. Like, oh, I'm going to distract myself. I'm not going to think about that. But then an hour later, you're right back to, oh, this problem is still here. So, and then sometimes with procrastination, the problem just gets bigger. So avoidance and numbing strategies typically make you feel better, which reinforces them, but don't work in the long term. So some healthy stress reduction strategies. I tried to group these into physical, financial, spiritual, and emotional. But a lot of them really overlap because if you're working in one area to correct something or to reduce stress in that area, it can often improve the other area. And I included this picture. This was from... let's see, where was it? It was Sequoia National Park, and wanted to go there and see the beautiful trees, and it was in May, and so I was thinking, oh, we're going to have really great weather, this is going to be wonderful, and then boom, dropped all of the snow, and we could barely hike, and but then, so that was like, I had to think, okay, you just have to change your expectation here. You have to take what's come here, sort of with, cancer, boom, it just drops on you. So how does that change your expectations, and how can you deal with those like changed expectations and live with those? So starting with the body, if your doctor recommends it, get the flu shot. That's the first thing. So she said she had hers today. I need to get mine, so that's on the test list. Dress warm but comfortable for the holidays. No sense in going places all dressed up and not being comfortable. Definitely using antibacterial hand wash when traveling. So you may do a good job at taking care of yourself, but you're in an airport. People are touching all kinds of things, so use your hand wash. Consider healthy options for parties. So if you have a healthy dish, consider taking that to the party and eating that primarily. Drinking a lot of water when you go to a party so you feel fuller. And then trying not to stand near the snack table, like getting as far away from that as you can, and trying to avoid grazing during those times. Stretch prior to, during, and after long days of cooking, eating, and wrapping. So during the holidays, we might tend to push ourselves to go all day, and sometimes meal preparation. If you're preparing for a lot of people, that can take 8 to 10 hours easily. So just being sure that you do take breaks and rest and stretch out. And then many of us wait till after the holidays to start any kind of exercise program. Oh, I'll wait till January 1st. That seems like the perfect time. Yeah, so you're putting off on, through that might be a good idea, so you could enjoy the holidays and not be recovering. So that's the other side of it, when you're waiting on surgery. But if you can, start some minimal exercise before the holidays, so you're not trying to start something early in the year when there's already a lot of changes happening, so you'd get a head start. And then how many of you have heard of activity pacing? Yeah, so what is activity pacing?
Not taking on too many things at one time, pacing yourself as you participate in different activities, and making sure that if you are doing more than one activity, you're actually planned for it, you've actually planned for them and are prepared for them.
Yeah.
So it doesn't cause extra stress.
Yeah, that's a terrific summary. So she was talking about prioritizing your activities, so knowing which are most important to accomplish, planning those activities that you're trying to do. And one of the things with activity pacing, so what tends to happen when people are sick and they have either pain or fatigue is they might have a good day, and on that good day they're going to try to do everything that they might feel like, oh, I got to get all this done because I'm having a good day. But then what happens the next day is really crashing and just not being able to do anything, and then you might spend the next couple of days in bed. And then with this cycle, because you're down and out for a couple of days, you might start to feel bad, like, oh, I can't do anything. And then it starts all over because you'll have a good day and then try to cram everything in. So activity pacing is really breaking down your activities into what's most important, and really, if you know your limit cooking, you start to feel a lot of pain or fatigue after an hour of cooking, break that down by half. So you want to stop before you start feeling really fatigued or in a lot of pain. So, and take a break, take a break for 15 minutes and then get back up and do it. Just be sure, like you were saying, it requires some planning so that you're not just cooking the turkey for 6 hours, you're planning those breaks in between. And that goes for any other activities, not trying to cram too much into one day. What about any other strategies that you have used to deal with stress and take care of the body?
Delegating.
Uh-huh.
Making sure that if there are a lot of things that you have to do, you have help with.
Mm-hmm.
It's really easy to try to take on everything yourself, and then you have those instances where you crash. So it's really helpful if you delegate things instead of trying to do everything yourself.
Mm-hmm. Yeah, definitely. So she was saying delegating task, and we'll talk a little bit about this. So that requires knowing who's in your support system and what they might be best at or what they can do to help out in that support system. Anything else that you might do to take care of your body during the holidays?
Getting plenty of rest.
Mm-hmm. Yeah, I'm surprised I didn't put that, paying attention to your sleep. So making sure you know how much sleep you need to function, and then trying to stay on a sleep schedule that works for you. Yeah. Okay. Financial health. I think we often forget this as an aspect of our overall health until after the new year, when the damage is done. So make a list and check it twice. And what that means is think about who you might be buying or making gifts for, and maybe this year, if it's particularly a financial crunch, think about is it necessary to have everyone on that list? Do you need to buy for everyone? And, especially if you have a really large family, everyone in that family circle, or, is there a certain age point that you stop buying gifts, or do you want to just get, or make like one important gift for certain family members? So really think about who you're spending for. Developing a budget and trying to stick to it. So what is your budget for the holidays? Knowing what that target number is and trying to stick within that budget. Rotating holiday celebrations. So if the holiday celebration is always at your place and you're just not feeling up to it, having a lot of back pain, for instance, see if you can go elsewhere, like delegate to another family member. Oh, I think it'd be really great if we went here. And that's true. Just I know my siblings, we try to rotate during the holidays where we go, so it's not all on one person. And we definitely have each other bring stuff in, so it's, again, not all on one person. Do shopping in advance or online, so you don't have to be out in the crowds like with pain or fatigue. And then don't forget the coupons. Like, I rarely now will ever go into a store and pay full price for anything, especially with a phone. I will look up like Retail Me Not or Coupon Sherpa or wherever I'm going, blank coupon, and that'll pop up like, usually 10, 15, 30% off. And so that way you can save some money. And then homemade gifts too, like, either things that you make or cook. Like on one side of our family, it got so large, I was always amazed. My grandmother would knit different things for all of the grandchildren, and I would think, my gosh, she must have started in January to get that done by December. And yeah, how much I appreciated that, just. Yeah, they multiply, and then it's just so much knitting, and just so appreciated when you can make something homemade. And I remember in college, was really limited on the funds, and so I got my parents mugs and just wrote them like a nice verse or something on it, and they loved it. So think about other routes. Are there other things that you guys do to stay financially fit during the holidays?
I never stay on budget, so, you know.
Uh-huh. So budget's a problem sometimes, yeah. Mm-hmm. Anything else that no, this is one where we all just do our best. And then, come January, what just happened? So spiritual health, I define spirituality pretty broadly here. So, and this picture just reminds me of one of my good friends was talking about. For years, she had these expectations to take her kids to see Santa, and every year she thought she was going to get this really wonderful picture, and then something like this would happen, and it was just a huge stress for her to get them dressed up. And she said, why am I doing this? Why are we causing this stress for the whole family when it never works out? So then they found something else fun to do. And so I always think about that. Well, if things aren't working out, think about how you can change your expectations.
When things like that happen, that's actually kind of cool, because you can look back on the different stages of how the kids reacted to different things. So even if it's what you think is a bad photo, it's cute. And later on down the line, when they get older, you can laugh about it.
Yeah, but in the moment, you might feel stressed. So that's a whole thing, changing your perspective about it. In the moment, in the future, I might appreciate this so much more. So I'm just going to let go of that expectation that it's going to be this way right now. I had created some handouts. Would you mind? Okay, great. Thank you so much. So, there's 3 different handouts, and one of them just asks kind of a simple question. And if you brought a pen, take a moment and kind of jot down your responses to this question. But what 3 things are important or meaningful to you during the holidays? So we're just going to take a minute and do some writing. Okay, so I'd like you to think about which of these is most important. So if you haven't listed them in order of which feels most important to you, just think about that and then put them in order in your mind as to which is most important. And then there's a calendar at the bottom. So think about when you would prefer these things to happen. Yeah, that's true. And that's yeah, she's talking about Xing it out and just not doing any of it. Yeah, and so that's an option. And this just gets you thinking about, if you just want to have one thing that you do during the holidays that makes sense to you and makes it meaningful, and you've done that, you are good. So the more you kind of layer on in terms of things that you feel like you have to do, the harder it can be. And then also, with whom do you want to do these things and with whom do you not want to do these things? And so keeping that in mind, that you really do have a choice. And it may not feel like it, but you do have a choice with who you spend time with during the holidays. And so really trying to set some limits on that. So if you get one thing on that list accomplished, you are all good. And you don't have to do 8 to 10 things to make it a good holiday. Refining expectations. So thinking about gifts as heartfelt versus perfect. So is this a good enough, gift? Yes, it's a good enough gift. It's a gift, and it, means something to me. Whether or not the person receives it with my intent, that's up to them. I don't control that, and that's all right. Challenging comparisons. I think our minds have a tendency to just go there, just to do comparisons with other people, and I've really worked on that over time, and that's probably one of the most helpful mind games or mind strategies that I use whenever my mind goes to starting to compare. Oh, well, they might be doing this, or they have this, or I'll immediately call it out. Like, oh, mind, you're doing a comparison here, and that's really not going to help me. It's not going to help anyone. So really trying to eliminate those comparisons that you're making. And again, is this a have to or a want to? You really want to fill your time as much as possible during the holidays with want tos versus things that you feel like you have to do. What about that? Do you feel like that's something that you do, or?
I think I turn everything into a have to.
Mm-hmm.
I have to cook, I have to clean, I have to buy gifts, I have to decorate, I have to do this, I have to do that. Everything turns into, at the holidays, everything turns into a have to.
Yeah, she's saying everything turns into a have to. And I think that's on that list we looked at, that holiday stress, just that extra pressure to do or to feel certain ways. What do you think is the consequence for you when you have a lot of have tos?
I'm usually stressed during the holidays, and then after the holidays, I usually kind of crash.
Mm-hmm.
I know last year, even though I was taking treatments, I still tried to do everything because my family was used to having Christmas at my house, having Thanksgiving at my house. And, there's a certain expectation, and then you don't want to drop the ball, and you don't want to lower the bar either. So I usually got sick afterwards.
Yeah, so she's telling a really familiar story. So because you've usually had everyone at your place, you tried to do everything and tried to do it as well, to the standard or expectation. And that created a lot of stress for you, and then you crashed after the holidays. And
Actually, I think I actually went to the hospital on Christmas.
Oh, you did?
So, yeah.
Uh-huh.
That was last year.
Yeah, so she was doing all of that during treatment. And looking back on that, what would you have done differently, or could you have done differently?
I probably would have delegated to someone else's house, but at the time, I felt okay when they asked, and so I was like, okay, yeah, I'll do that. But then afterwards, I should have known better, but now that I do.
Yeah. And she was the first to say delegate when we were talking about other strategies. Yeah. So, and even if you have said yes, even if you've said yes to something in the moment and you were feeling really good about it, there's always a no. And you can always go to that no, because things change, especially with cancer. You may be feeling well, and then all of a sudden you're not. Something comes up, you're just extremely fatigued or in pain, and that no is always there, and the redelegation is always there. So thank you for sharing that. Setting boundaries. So one of the things that comes out a lot during the holidays that I get to hear a lot about in my work is family dysfunction. And one of the biggest... Well, I can just tell you that there is a whole range of family dysfunction, and there is no family without dysfunction. So if you're walking around with that load of, oh, I'm the only family with dysfunction, you are not alone. Yeah, there's always some type of dysfunction. So the best you can do during the holidays with that family dysfunction is to remain civil. Just try to keep your cool with it, but do not tolerate abuse. So if you're going to go somewhere or someone's coming and you're expecting emotional abuse, heaven forbid, like physical abuse, please talk to someone like a social worker, anyone at the hospital to help with that situation. But if it's emotional abuse, use your boundaries and, maybe say to the person, like, I'm only going to be here for half an hour, or I'm only going to be here 15 minutes, and then I'm going to go. And if the abuse starts, we're just not going to do that today, and the end of it. Because you don't need that to add to the stress of the holidays, especially if you got cancer layered on everything else. Acceptance can be another key strategy for you. Accept that now may not be the best time to resolve family conflicts or problems. You may think, oh, everybody's together, we're going to do a little intervention. But, you have this time of year to try to generate some positive energy. So maybe move the intervention to a different time or place. Talk to family members in advance about your holiday plans, and again, consider alternating so it's not all on you. And then set some healthy boundaries for yourself, like too many things going on, say no. I'm sorry, I can't do that. Or that really sounds like fun, but I just have too many things planned already, or too many things on my plate. Assert yourself. So if there's something really stressful going down in your family, you have a right to say, when you do X, I feel Y. I'd really appreciate it if you didn't do that right now, or do that. You may not change, and in all likelihood, you're not going to change that person's behavior, but it is really important that you assert yourself for your self-esteem. And that could be the only reason that you do say something in a situation. It may not change it, but at least you've put it out there. And generally, instead of saying something like, when you, I always use the laundry example because that's common for most. When you leave the laundry sit in the basket after it dries, and then I get all wrinkly, I get really angry, and so could you please fold them after you take them out of the dryer? So I usually won't use the word angry because that just puts people on the defensive. But when it's your turn and you take the laundry out and then they don't get folded and they're wrinkly, it's just really a pain, or adds more stress because then we have to do something about that, or wear wrinkly clothes, which I typically do to solve the problem. And so then using terms like I feel upset or I feel bothered, that tends to go over better than I feel angry. And then asking for help, one of the biggest things that I think we tend to do is, one, either think that if we don't do it, it's not going to get done right. That's a typical thought that keeps you from asking for help. Or you might think, they should know what I need. They've seen me do this, year after year. But people can't read minds, and sometimes you have to say, can you move this, or can you help me with this, or let's do this. And then often they might feel good at being able to help versus trying to read minds. Tips for saying no. I really like grumpy cats, so ho, no. So remember that, just to help you to laugh a little bit when you're having to say no, because sometimes that can be hard during the holidays. A good way, I can't commit to this as I've made other priorities, which you have. You've made your top 3 list, and if it's not on that list, it's not on your top 3 priorities. Let me think about it first, and I'll get back to you. That's really good with someone who's putting on the pressure. Can you do it? Can you do that? Good. Yeah, just give yourself some time, because it's a lot easier to come back and say, I thought about it. I really can't do this. I'm not the best person to help on this. Why don't you try X? So that involves giving up your notion that you're going to do it best, and might be good training for someone else to learn how to do it. And don't feel that you have to give a reason. You may need to repeat yourself several times. So if it's in your mind that you don't want to do something, you really don't have to give a long list of excuses or explain yourself. You have the right to say, no, I just don't want to do that. And then with really persistent people, you have to keep repeating, no, I'm sorry, I don't want to do that. I'd like to take a minute and just talk a bit about mindfulness. You've probably heard of mindfulness, and I don't know if you've ever practiced any mindfulness strategies. Really, anything can be a mindfulness strategy. So mindfulness can be washing the dishes, like you're just in the moment doing your thing. You're not thinking about other things. You're really focused and intent on doing that thing. You're reading. You might be mindfully reading. It's just being in the present moment. You're being non-judgmental about things. And so a lot of times you've probably thought of like meditation as you got to be sitting in lotus posture, and you've got to, which is crossing your legs and sitting like this. You can't let any thoughts intrude, so your mind is clear, but that's not meditation at all. Meditation is just being where you are in the moment. And so if you have a lot of thoughts coming in, that's just food for thought, just being aware of what's going on in the moment, being aware of all those thoughts. And the more you sit with your thoughts, the more you start to observe patterns in your thinking that can be helpful to you. So you're not trying to get rid of thoughts, you're just trying to be there in the moment and not judge them, not push them away. So everyone can be more mindful. And then diaphragmatic breathing. Everyone does this a little bit differently, so I'm going to show you like a real simple diaphragmatic breathing technique. So go ahead and put one hand on your upper chest, and then one hand right above your belly button. And if you're doing deep breathing, like if you've watched a baby breathe and their whole chest rises and falls, that's kind of what you want to have happen here. And you want to pull the air more to your lower hand so that expands. So go ahead and take a deep breath in. Then breathe out. Then you want this hand, upper hand, to stay kind of still and your shoulders down as you're doing it. You really want to pull the air into your belly, which means your diaphragm is expanding. You're getting air into both lobes of your lungs. So try that again. And if you're doing deep breathing, you're getting more oxygen all at once, and you should be able to slow your breath down to about 6 breaths per minute. So to do that, you would breathe in 2, 3, 4, 5. Breathe out 2, 3, 4, 5. Breathe in 2, 3, 4, 5. Breathe out 2, 3, 4, 5. And that's one of the quickest and simplest relaxation techniques that you can use. I frequently use that at work. If I catch myself getting stressed about something, I'll just take a few minutes and practice some diaphragmatic breathing. I already feel calm from just doing that for a few seconds. Typically, you'd want to try to do that 3 times per day, and definitely before you go to bed, because you want to get in the habit of kind of observing your breathing and breathing at kind of a slow pace, because it really will slow everything down for you. It's hard to be mentally stressed if your body is physically relaxed. So moving on to emotional health, these are some of the strategies for emotional health. So focus on what matters most to you. So anything that's not on your list may not matter as much to you. So maybe being able to let go of those things that matter less. Trying to do something joyful every day. That can be as simple as, for me, I have this carpet by my bed and I like to put my feet on it in the morning, and that makes me happy. So that's a simple joy. So I've already started my day off doing something that makes me feel good. Engage with supports wisely. So know who's in your support system and what they're good at. Some are good at making you laugh, but boy, they will never be there for you if you need a car ride. Some people are good at going to a movie with you or just enjoying some downtime, or some people are good at just sitting on the couch and not saying anything, which you might need. Some are good at loaning money, but not a whole lot else. So know what the people in your system are good at, and if they're asking to provide help, elicit the type of support that they're good at. Where we run into problems a lot of times is trying to elicit the wrong type of support from the person that's not good at providing that kind of support. So it's all about the fit of support. And try not to put all your eggs in one basket where you try to get all your support from one person, because that doesn't work. It doesn't work either. And then recognize if or when you might need some professional support. We'll go through maybe a few scenarios where that might be indicated. So coping with grief during the holidays. With cancer comes a lot of different losses. So maybe loss of physical functioning, losses due to pain or not being able to work, loss of energy, sometimes loss of hair, just loss of concentration sometimes. So you, just acknowledge that you have, if you're on this journey with cancer, that there are probably a lot of things that you may have maybe missing as a result of going through that experience. And it's okay that you may not be kind of back to where you were prior to the journey with cancer. Make time for grief and laughter, especially during the holidays. If you're grieving, sometimes it can feel like if you have moments of joy, that can feel really odd, like, oh, should I be enjoying this? Because then I'm not respecting the loss of that person. But over time, you get more of a mix of grief and laughter, and recognize it as a cycle. You're going to have periods that come up again and again where you're thinking more about the person that you lost, and then periods of joy. And I know when my mother passed, like I couldn't be around frogs or look at frogs without getting really upset, because she really liked frogs. But then that passed and changed for me, and now I see frogs and that brings me a sense of joy or pleasure again. So things change with grief, and grief, if anything, requires time. Decide how you want to spend the holidays. So when someone you love is not there, do you want to, it's a perfect time to ask, do you want to change things up, change how you're maybe approaching the holidays? Consider how they may have wanted to be remembered. So is there an organization that you might make a donation to, or is there a quiet time that you might spend, like communicating with them? Do you have letters that you might read, or other ways that you might be connected? And then I remember like after my mother died, like there was a Blue Christmas gathering in a religious setting that I went to, and I found that really helpful, because when you try to go to things where people are really celebrating the holidays, it just feels really strange. And so having a place where you can go where the energy is more subdued and you can really think and reflect, that can sometimes help. What have you guys done with grief, or to recognize? loss during the holidays?
My father died a few years ago on the 21st of December. And so it was difficult for us to, that year we didn't celebrate Christmas. Everything kind of just got lost in the shuffle. But after that, the following Christmas, we started, like he was really big into making everybody laugh and wanting to make every day special for everyone. So we would sit around and tell stories about what Dad did or what Dad said, or just remembering how he made everyone else happy. So.
Mm-hmm. Yeah, so that's a perfect way to remember him. She's talking about kind of inviting him into this celebration after the first year and just remembering him by laughing or telling stories about her dad, which is a great way to remember. Some people will go to the gravesite and maybe leave flowers, and some people will leave an extra plate at the table. Some people will just light a candle or do something in remembrance. So all of those things can help you to kind of, move forward with your grief process. So grief is a little bit different than depression. I don't know how many of you saw this movie, like Inside Out. Did anyone here see it? Yeah, one person saw it. I just love this movie. I think it's such a great representation of the feelings and emotions and how they work together. So this little lady here is the depressed lady in the movie, and she's a little bit like worrisome or anxious too at times, but it's really clever. But depression looks like this. So for a person to be diagnosed with depression, they have to have one of the first two things. So depressed mood most of the day, nearly every day. So it's not just, I feel depressed once or twice a week. It's pretty much every day that you might feel down. Diminished interest or pleasure in activities, and that's not, say, as a result of pain, you may not feel like doing things that you used to do because it makes the pain worse. It's just you really just don't feel mentally engaged or want to do much of anything. And then you have to have at least 5 of the other criteria. So significant weight loss or gain or change in appetite, changes in sleep, psychomotor agitation or retardation, so that just means either feeling restless or slowed down, fatigue or loss of energy, feelings of worthlessness or feelings of excessive guilt, difficulties with concentration or decision making, recurrent thoughts of death or suicidal thoughts. And because when people are going through cancer or cancer treatment, you can have a lot of those symptoms just as a result of having that. What do you notice on the list that you think, that can be related to cancer?
Actually, all of them.
Mm-hmm. Mm-hmm.
All of them.
Yeah, all of them. And I would say definitely probably 80 to 90% of people will experience some changes in appetite, sleep difficulties, fatigue, difficulties with concentration.
Especially agitation. It seems like every little thing got on my nerves,
Mm-hmm.
especially while I was taking chemo. Loud noises, like if the kids were laughing too loud or arguing or just any little thing made me agitated.
Yeah, she's talking about changes in agitation and being more easily or more sensitive to things going on in your environment. So really needing much less stimulation before you get kind of overwhelmed. And that definitely can be part of chemotherapy. Because so many symptoms overlap with the chemotherapy and whole cancer experience, we also look for are people having problems with cheerfulness, where they're crying every day, just not feeling like they want to be around other people? Are other people around them saying that they seem depressed or sad? That's always key to me, because if someone's with you all the time, they really know what your mood is typically like. Is the person feeling pessimistic or hopeless? And then are they feeling emotionally numb? So are they just not really experiencing any pleasure or sadness, just like feeling really blah about things? So all of those two can be clues to me that the person's experiencing depression and not just some of the side effects of chemo. So those are things you would look for with depression. Seasonal affective disorder, they kind of changed that in the manual of how you diagnose, but sometimes it's called winter blues or seasonal depression. And so now they say that the person has to meet full criteria for depression, so what we were just looking at, but it occurs only during the winter or summer, and I have a hard time. I don't think I've met anyone who just has summer depression. Maybe that's in different states, like maybe Alaska or something, if the days get shorter, but it can be just during a prescribed period, and it has to be to really meet criteria for seasonal affective disorder. It only happens during that season. Treatments for seasonal affective disorder, probably the top treatment is light therapy. Bright white, full spectrum light at 10,000 lux at 30 to 60 centimeters from you for 30 to 60 minutes a day. And you can get, you can get a light therapy light at most like big department stores sell them, but just be careful about what light it provides, because this is pretty specific pattern of light that works. I don't think green light works as well, and blue light kind of has mixed results, so it would have to be white.
I guess I'm curious as to what the rationalization of light does. I mean, what would the light therapy provide?
Yeah, I think it has.
Like sunshine?
Yeah, sort of. It's like stimulating like your circadian rhythms, so our days shrink during the winter, so there's less light that we're exposed to. So that could, and if your circadian like kind of sleep pattern is off, sometimes they'll prescribe melatonin too, and that can help with seasonal affective disorder. Cognitive behavior therapy, that works for seasonal affective disorder, depression, and cognitive behavioral therapy is just working with people to, the model is based on the fact that how people think and how they behave contributes to their moods. So it's just helping them to change their thought patterns and change how they're interacting or behaving. And that impacts mood. And there's some studies now that suggest that just like medications change chemical balance, that CBT can actually change chemical balance in different parts of the brain than what other medications or antidepressants might do. So, and antidepressants too are an option. So in terms of professional support through the James, if you or a family member are a patient or family member at the James, and you find that you're struggling with depression or seasonal affective disorder, you could talk to your medical team about a referral to psychosocial oncology, which includes psychologists, social workers, and we can bring in chaplains too if there are spiritual issues that are contributing. And the scheduling number and person that can answer the questions, Pam, is at 293-2957. And then we're approaching time to wrap up. So we've kind of talked about how to define stress. So stress is just feeling like there's just too much and you don't have the ability to cope. So you can either change what that too much is if you have too much on your plate, or work on how you're coping with that too much. We talked about the health impact of stress and the emotional impact of stress. And then we talked about several different strategies to reduce holiday stress and improve physical, financial, spiritual, and emotional health. And not just reduce holiday stress, but just reduce stress in general. I'd like you to take a moment and maybe flip over one of your sheets and write down something that you've heard this evening that you would actually like to implement to reduce your stress. It could be any of the strategies that we've talked about, just to remind yourself, hey, I'm gonna try this to reduce my stress this year. Okay, and then we talked about grief, depression, and sadness, and some of the differences and strategies for managing that during the holidays.